Approximately 5 million Americans suffer from chronic open sores that can become seriously infected, gangrenous, may require surgical procedures, amputation, or even death. If you have a wound that won't heal, Catholic Health Services can help. Stay tuned to learn more about CHS's hyperbaric medicine and wound healing centers and how they can provide relief and treatment for your chronic, non-healing, or poorly healing wounds. It's all on today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, everyone, and thanks so much for joining us. I'm Jane Hansen. Today's conversation, hyperbaric medicine and wound care. If you or a loved one suffers from a sore that isn't noticeably healing within 4 weeks, it's important to seek the treatment from a specialist. Catholic Health Services offers services at multiple locations throughout Long Island. Joining me now is Dr. John Jackalone, the co-medical director for the Center for Hyperbaric Medicine and Wound Healing at St. Joseph Hospital. Welcome. Good to have you here.
Thank you. Good to be here.
Now, you've got 3 centers within Catholic Health Services. This obviously is a really growing need. Why is that?
Well, I think as the population ages, as our lives become more sedentary, we're seeing a lot more diabetes, a lot more peripheral vascular disease. Also, as our medical care gets better, our population is living longer. And as those patients live longer, they encounter more and more complications later in life. So I think it's a combination of all those things that are creating a necessity for these types of centers.
And it's better to have these centers than to just go to a regular doctor, because he or she probably can't give you the kind of treatment that you can.
Well, he or she may have the skill level and the skill set to treat you, but what they don't have is the supplies that we have, the tools that we have. Hyperbaric oxygen chambers being one of them, a closet full of advanced wound healing. It's very difficult for a private doctor in today's environment to stock his office to take care of these wounds, and week by week these wounds change. So the product that you put on the wound last week may not be what you need to put on this week. So it's very nice to be able to go to a closet, have specially trained nurses, photograph, special wound care software. So it's more about the tools and the convenience than it is about the skill set.
Let's get to the basics here. What kinds of wounds or sores are we talking about? Big giant ones or little tiny ones?
It runs the gamut. Some of these wounds are very, very large. You can have someone with a dehisced or open surgical wound, and you could have someone with a tiny little wound on the bottom of their foot that's draining because they have a bone infection, and it's draining through the wound. It's what we call a sinus tract. So some of these wounds are very, very small, but regardless of the size of the wound, they have a large impact on the patient's lifestyle and overall health.
So how do you know that your wound or your sore really needs kind of special treatment, needs to come to you guys?
That's a good question. I think it's really individual. I mean, we do have our numbers. If it's not improving within 4 weeks or healed within 8 weeks, it's considered a chronic non-healing wound. But I think the patient really knows themselves. I mean, we've all had cuts and wounds and scrapes over the years. And if you've got something that, you look at it and you say, you know what, 5 years ago, this would have been healed and it's still open, it's always better to just seek the opinion of someone who knows. Worst case scenario is they treat you and you get it healed. Best case scenario is they say, you know what, this wound is fine. Let's see you back again in a week. So better safe than sorry.
So hyperbaric chambers, what do they do? How did you discover that this really helps wounds?
Well, hyperbaric medicine really comes from the treatment of diving injuries. Years ago when divers or deep sea workers, actually a lot of it comes from the building of the Brooklyn Bridge when they pressurized the caissons and the men went down there to work, they would develop decompression sickness from coming out of that pressurized environment. And treating those injuries, that's really how hyperbaric oxygen therapy started. People started to realize that oxygen had a very positive effect on the body. First thing that happens when you go into the emergency room with just about anything is they give you oxygen. And people started to use oxygen kind of as a fountain of youth type thing. We've learned later, in medicine as we've researched that increasing the oxygen level in a tissue or a body part can actually help that body part to function and heal.
So somebody comes to you and you say, you determine from the way you see the sore or the wound that this would probably be a good option for them. What happens next?
Well, the first thing you have to do is step back and look at the patient as a whole. Only about 30% of our wound care patients actually become hyperbarics. So not everyone needs it, not everyone's eligible for it, and it's not safe for everybody. But most patients that need it, we're able to get them in. But basically what we need to do is assess them, make sure that there are no safety issues, they have no hypersensitivity to oxygen. But really the main thing, and my biggest pet peeve, is you really need to know what the patient's blood flow is. Because it doesn't matter how much oxygen you pack into the bloodstream, if it's not getting to the affected body part because they have vascular disease or blockages, you really need to correct that problem before you put the oxygen into their system.
So they go have treatments. It's a fair number of treatments for quite some time.
The average protocol is about 30 treatments, so the patients come in for about 5 weeks. Some patients go longer than that. If I see that a patient is not benefiting from the treatment about halfway through, I'm going to stop and step back and say, you know what, let's take another look at this because I'm not getting the result that I want. Maybe we need to revisit your vascular situation or your blood sugar or your offloading at home. You know, most of these wounds are caused by pressure. If you don't remove that source of pressure, all the treatment in the world is not going to make the patient better. So talking to them, you know, how do you sleep? Well, mom sleeps on her left side. Well, all of her wounds are on the left side of her lower extremity. You know, really investigating, being a detective and finding out what's causing it. Once you remove the cause, then you can treat the wound.
Well, it just strikes me because the reality is you're really a foot doctor. Feet are your specialty.
Yes.
So if you have a sore in the bottom of your foot and you put pressure on it, what you're going to do every day.
Average person is taking 8,000 steps a day. So imagine if you could walk on your hands. If I snapped my fingers and taught you to walk on your hands. Look at your hands at the end of the day. 8,000 steps with all of your body weight. Your hands are not going to look good. Your feet do this just about every day. And if you've got an underlying metabolic condition like diabetes, or you're a smoker, or obesity, or vascular illness, any kind of injury or trauma to the bottom of your foot's not going to heal. Also, we wash our hands all day long. Your feet are in a dark, moist, sweat environment. There's bacteria there, there's fungus there, so your feet are not as clean as your hands, no matter how clean a person you are. So there's a bunch of different things that kind of cascade to create one of these wounds. And
in your opinion, though, this has really changed the face of how you treat these wounds.
Absolutely. Absolutely. The tools that are available to us, the hyperbaric oxygen, the results that you see are really, really amazing. And I've seen this kind of grow in the last 15 years since I'm practicing, where, you know, a wound care center was kind of an oddity. Nobody knew what it was. I think in a couple of years you're going to see wound care centers as common as a radiology department in a hospital.
Because these people used to be admitted to the hospital, and now instead they're able to have this kind of treatment and be outpatients.
That's correct. Then you think about putting someone in the hospital. They're immobile, they're in bed, they're not exercising, it's hard to manage their sugar, they're not getting their blood flowing. There are infections that can happen in a hospital because hospitals have sick people there. And no matter how good a job you do, a patient is always better treated at home as long as it's safe for them. So yeah, we love to keep people out of the hospital, keep them in their environment with their family and their support system. We find it has a really good effect on them.
Well, thank you very much for explaining all this to us, Dr.
Pleasure.
Jacquelone. Keep up the good work. We have to take a quick break, but still to come, how Catholic Health Services is continually expanding to offer the best wound care treatment to the communities they serve. We'll be right back. Welcome back to CHS Presents Lifestyles at the Heart of Health. Joining me now is Neva Bolding, the Program Director of the Hyperbaric Center at St. Catherine of Siena Medical Center. Thank you so much for joining us today.
Thank you for having me.
Good to have you here, and I understand you guys do great work there.
Yes, we do.
So recently you have added a hyperbaric chamber to all the services that you have, and you've really got state-of-the-art, latest, greatest stuff going on there. So tell me about it. What are you able to do now that you weren't able to do before?
Well, with the addition of the hyperbaric program to the existing center at St. Catherine's, we're able to treat patients who have chronic wounds, patients who have bone infection, patients who have had radiation due to cancer. Hyperbarics is a program that Dr. Cohan has been fighting for the past 5 years that the center's been open. We've recently been able to incorporate that to help heal wounds faster, to give patients back their quality of life and improve their quality of life.
So what you say is that people used to just have to live with these chronic sores or open wounds.
That's correct. We've had patients who've had wounds for upwards of 5-10 years. Who weren't getting the best treatments with their primary doctors. Not that they didn't know what to do, but simply because they didn't have the appropriate treatments that we now use within the wound care system. We have skin substitutes that we can use. We have grafting from the body to the wound itself to help close that wound. There are other dressings that we are using within the wound care center that isn't used by primary doctors or visiting nurse services. So these things help to reduce the size of the wound, reduce edema. We try to fight infection, whether it be with the antibiotics, oral or IV PICC lines, or a combination of that and hyperbaric.
So it becomes very complicated treatments.
It can be, but it definitely improves the life of the patient.
So tell me what you've seen. Tell me about your experience with some of these patients, about how this has changed their lives.
Well, I can tell you about a story I have with a patient in particular who one of the doctors wanted to get into the hyperbaric program. And this patient was quite resistant. He has a wound, and he was told that it would take 18 months by another specialist to heal that wound. And the patient felt that he could live with a wound on his leg for 18 months. I went in, I spoke with him, I oriented him to the possibilities of hyperbaric treatment and how that could heal his wound much faster. And again, he was very resistant. We used another patient to give testimonial as to what he should expect, how he felt hyperbarics was improving his quality of life and improving his wound. And within 30 minutes of that patient leaving the center, he called me back and said, you know what, I'm going to do the hyperbarics. So now we have a patient who gave a testimony, and the patient who decided he would do the hyperbaric treatment has a wound that's almost healed.
Almost healed already?
Within 3 weeks, almost healed.
And we're far from 18 months.
Far from 18 months.
Well, that's a great story.
Yes.
So let's take a look at some video now so we can hear some other patient stories. The Hyperbaric Medicine and Wound Healing Center at St. Catherine is helping patients, as you've just heard, faster recovery, decreased hospitalization, etc. So let's take a look at this video.
My name is Peter Pisoni. I live in West Islip, New York. I'm married for 55 years. I have 5 children, 7 grandchildren. I've been diabetic for over 20 years. And it's a disease that you can control. And for a long while I did, but apparently at some point I lost control of it, and that's what caused this problem. I wound up with a diabetic ulcer on my heel. Went to a podiatrist, didn't help. Went to my family physician, told me I needed wound care. I went to wound care, met Dr. Melman because they found that I needed extra blood flow into my leg. He did the surgery to bypass an artery. I now have plenty of blood flow, a good pulse, and the diabetic ulcer started to heal. But to speed up the healing, they told me I would go into the hyperbaric chamber. And it has really worked wonders because the heel ulcer, which was originally the size of a $50, is now completely gone. And the skin is starting to grow back. I now have no pain when I walk on it. It's just a miracle. Well, the hyperbaric chamber is the fastest way to get it healed. And I'm a great one for following directions with the doctor. When the doctor says you should do this, I don't argue with him, I just do it. I mean, it's just a wonderful thing to happen. You know, it heals. I had scuba dived, And basically what it is, it's the same as scuba diving. They put you into the chamber, they increase it's 100% oxygen atmosphere. They increase the pressure to 2.5 atmospheres of pressure, which is the equivalent of scuba diving at 70 feet deep. The pressure and the forces the oxygen into your system. Red blood cells pick up extra oxygen. And red blood cells, from basic biology, that's what heals everything. So it seems to be working fine. They do have a TV set and you can watch TV. And I've been told on a number of occasions that they wanted to talk to me, but I was fast asleep. So it's like a 2-hour nap every day. The staff here is wonderful. I mean, they answer any questions you have, any problems they can take care of. The institution itself, Dr. Melman, is excellent. I mean, he's really gone to the nth degree to get this thing to heal. As a matter of fact, they did ask me to speak to a prospective patient, and I convinced him that he should go to the hyperbaric chamber, because it's either that or you can spend a year and a half trying to get something to heal, or you can do it in 30 or 40 days. So, it just makes sense.
So that's another patient's experience, but what strikes me is now you send them home and they're healed from that particular sore wound, but do you have to educate them about how to not have something reoccur?
Yes. Before the patient leaves every visit, they're given patient instructions. And when they are discharged from the center with a resolved or a healed wound, we like to give instructions as to how to prevent this from occurring again. We give education on nutrition if the patient is especially a diabetic. We want to talk about offloading the wound. If it's a wound that's newly closed, we want to continue to offload that
What's
area.
What's that mean, offloading?
Offloading,
you mean keep pressure off it?
We want to keep pressure. If it's a wound that was on the foot, on the heel, on the toe, we want to continue to offload to give a supportive shoe for that wound, or that area, so that it doesn't reoccur. We want to make sure the patient doesn't go home or leave the center and go walk the mall for 2-3 hours at a time. We definitely want that patient to, try to incorporate different things within their lifestyle that gives them a chance to rest, to improve.
Right, to fully recover.
To fully recover
and prevent
without
reoccurrence.
returning to the center with the same area opened up in less than 6 months.
Well, again, thanks for all the great work you do, Neva. It was a pleasure to have you here today. And if you would like some information or to make an appointment, the phone number is 631-784-7200. So we have to take another quick break, but don't go anywhere. We'll be right back with more CHS Presents Lifestyles at the Heart of Health. Welcome back to CHS Presents Lifestyles at the Heart of Health. Catholic Health Services is here for you. The system's state-of-the-art hyperbaric medicine and wound care is available all across Long Island. Joining us now from Mercy Medical Center is the program director of the Center for Hyperbaric Medicine and Wound Healing, April Garlick. April, thank you so much for being here.
Thanks for having me.
We've already talked about St. Catherine's of Siena, we've talked about St. Joseph's, and now we're at Mercy. Is there any distinctive things that you do differently, or is it just the location and the geography that makes it special?
Location and geography definitely makes it special. One thing that I pride myself on at Mercy is that I feel Mercy is a one-stop shop. So when a patient comes in with a wound, we try to do everything to heal that wound in a specific amount of time. So we work very closely with the diabetic educator. We make sure that any diabetic patient that comes into Mercy for wound care gets a diabetic consult, so they would know about the diet that they're supposed to adhere to. We try to give them a lot of education. We also work with an infectious disease doctor so that the doctors will know exactly what antibiotic they should treat the particular infection with. And we also have a close relationship with rehab, which is right next door to our wound care center. So if we offload a patient and we know that their gait is going to be off, we make sure that that rehab doctor would see the patient and offer, whether it be a cane, whatever assistive device that the patient can be safe.
Yeah, exactly. And of course, you want to help in the recovery process. Now, you talked about diabetes, but there's lots of other things that could lead to these kinds of sores or open wounds, such as
Peripheral vascular disease, arterial insufficiencies.
what's that mean?
Basically, when the blood isn't flowing properly. If you have any type of issue with blood flow, you can potentially cause injury to that area and poor wound healing. Also, we have late effects of radiation. Patients that have radiation damage, you see more internal wounds than external wounds. So they would more present with bleeding, blood in the stool, pain inside. So we also treat those injuries.
So it's a lot of different things. Now, sometimes people come in and don't think that you can do anything for them, but you've had experiences where this really works almost miraculously.
Yes. I actually had a patient that made me a real believer in hyperbaric oxygen. We had a patient, he was around in his 50s. He came in with something called necrotizing fasciitis, which is like a flesh-eating bacteria. Now, I've been a nurse for close to 10 years, and I've read about it in the textbooks. I've never really seen it in person, and it's really mind-blowing. He had the flesh-eating bacteria in his groin, buttocks. It was really devastating. When he came to us, he actually came on a stretcher. We had to transport him by ambulance every day for the treatment. In the beginning, the first 2 weeks, I'm just like, I don't know if this is going to work. Like, maybe we're just selling him a dream. By the 3rd week, he was coming to us in a cab. By the 4th week, he was healed. And now if you look at that wound, you wouldn't even be able to tell from the picture from day 1 to day 30 that was really what it was.
That just gave me the chills.
Oh, yes. He went back to his life, and it's really a great success story.
Tell me what happens with a patient. They come in, and it's a 2-hour treatment. So are they just sitting there in this chamber all by themselves?
Well, when a patient comes in, because you see pictures of hyperbaric oxygen and you see the chamber, sometimes it can take you back a little bit. Like, I don't know, maybe I'll be claustrophobic. So at Mercy, we really do an extensive orientation. We let the patient actually see. We would ask the patients that are actually in the chamber if we can have another patient look and do a tour. So we would do a tour. We tell them all the things to expect. The biggest thing really that patients will be concerned about is the fact that when patients go into an airplane, your ears pop. So that's basically the feeling that you may feel. 90% of our patients sleep. It's very comforting, it's very comfortable, and that's what really they say.
You're making me want to do it.
I know.
Is it covered? People ask about costs. Is it covered by insurance?
It is. Before the patient even comes in, once we identify that a patient is a candidate for hyperbaric oxygen, we actually send all the clinical information off to their insurance company, and all of the indications that are treated with hyperbaric oxygen are usually covered by insurance.
Well, that's very good to know. I'm going to invite our 2 other guests to come back in, Dr. Jackalone and Neva, and we'll just have a quick final thought about all of this, because these stories are really great. I mean, you guys are doing great work. Any final thoughts for people out there watching?
Skin is our biggest organ, and I just feel that skin sometimes is the most forgotten organ. So if you have chest pain, you see a cardiologist. If you have anything on your skin, you go to a dermatologist. So it just only makes sense to me that if you have a wound, you go to a wound specialist, which is what we're here for.
CHS has made great strides to bring this cutting-edge treatment to the community here on Long Island. And if you know someone who's dealing with a wound or a family member, it might be you yourself, please avail yourself of what's available, because it's really unique to have this type of treatment right in your own backyard.
Well, thank you all for the great work you do. It's been a pleasure talking with all of you.
Thank you for having us.
And thanks very much for joining us. And of course, if you want some more information or to schedule an appointment at one of Catholic Health Services' 6 outstanding hospitals, you can call 1-855-CHS-4500 or visit chsli.org. Thanks so much for joining us. I'm Jane Hansen, wishing you goodbye and good health.